Hi, my name is Jenny and I work with the University of Arizona Cooperative Extension in Pinal County with the Vision, Hearing, and Developmental Screening Program. In this cold and flu season, I thought we would talk about ear infections or fluid behind the middle ear and how it's the main cause of hearing loss in young children. Did you know that nearly every child will have at least one ear infection? Or that ear infections are the second most common illness in young children? Or that 30% of children will still have fluid in their middle ear even after an ear infection is cleared and they've finished all their medication? This demonstration will help us understand how fluid in the middle ear can affect hearing. For a child to hear normally, their middle ear must be filled with air. Hear how clear that sounds? When there's fluid instead of air, it's harder for the eardrum to vibrate and send sounds to the middle ear. This makes it harder for a child to hear. Hear the difference? If fluid becomes infected, it makes it even harder for the eardrum to vibrate and harder for the child to hear. Imagine being a child in a classroom and trying to listen to what a teacher has to say. Here are some things that can lead to an ear infection. A family history of ear infections. Children who are 5 years and younger because their eustachian tube is shorter. Children who attend daycare because they have more colds. Head and neck abnormalities such as cleft palate. Smoking in the home, allergies or asthma, bottle feeding while a child is on their back, or even cold and flu season. Young children cannot tell you that they're having hearing difficulties. If your child is having a hard time hearing, they may ask you to repeat things, or seem to ignore you and not answer when you talk to them. They may mishear things, or they may want the television turned up. They may also not be developing their speech and language as well as they should be. Remember, ear infections cause temporary hearing difficulties. Children with ear infections may hear sounds that are muffled or unclear. So call today for your child's vision and hearing screening. And remember, it's free.